first general annual meeting. My name's Leanne. I'll be serving as chair for the group today. Before we get started, I just want to do a little bit of housekeeping. So through these doors to the right, we've got the male toilets. To the left, we've got female toilets, and I'm assuming that the main exit that we came through is also the fire exit.
Yep, there's one more exit on the corner, but this one is the nearest.
This one's going to be the closest one. We're not cooking anything today, so we should be all right. Hopefully, there should be no fires or any emergencies. So you just have to bear with me, a slightly bit out of sync. So if we can just have all our phones on silent, so we don't have any unexpected interruptions. We have got refreshments outside, so you can help yourself as and when. And we will be having lunch, so there's lunch provided, and that should be taking place at about just after midday, or between 12 and 1. Yeah. So we'll have questions and answers at the end, but if there is anyone that wants to kind of interject throughout the program, if you just kind of give me a show of hands, then I'll invite you to address the group. That's okay. So Sickle Cell Cause. Sickle Cell Cause is about care, advocacy, unity, support and empathy for our community members suffering and those that live with people suffering and living with the sickle cell disorder. We're a voluntary organisation initially created under the umbrella of an organisation named Healthy Living International. And how that actually came about is that the members of Healthy Living International felt that it was essential for us to have a recognised body emphasising and actively supporting the needs and the grassroots needs of families living with and dealing with the daily challenges of sickle cell. So really that is our main purpose. And the purpose of this meeting, which is a yearly meeting, the general annual meeting, is to give our members the opportunity to hear updates on what's happening, such as what's happening financially, to update our aims and objectives, and to discuss coming events. Also to highlight the group's achievements thus far, and to record activities for the purpose of our action planning for improvement. And most importantly, to elect new management committee members to adhere to or kind of develop and uphold the group's aims and objectives. So I'll take this opportunity now to go through the aims and objectives. All this information in the packs that you've been provided, I'm going to go through the aims and objectives in a slightly slimmed down version. So I've got them in here in 4 key areas. The first is to raise awareness and to educate the general public on the sickle cell disorder via awareness programs in schools, churches, GPs, hospitals, councils, housing associations, in parliament and more. So really we want to go across the board in terms of generating awareness. To uphold and render welfare support for sickle cell patients, their families, guardians and carers, and support. When we say support, we're talking about support such as visiting and supporting patients whilst they're admitted in hospital, conducting welfare care, home visits, support with personal challenges, whether that may be to do with housing, benefits and family functioning, and also to support our carers of sickle cell sufferers with recreational outings. Next, to advise on prevention, care and self-help using healthy eating programs and holistic advice workshops. I personally feel that is one of the most important things that we need to develop and kind of move forward with. We want to cure sickle cell, and I personally believe that it can be cured. And lastly, last but not least, to work in partnership with other support groups and organisations that have an interest in sickle cell research, awareness and prevention. Okay, so those are the aims and objectives of the Sickle Cell Cause movement. 2006 looks to be a very action-packed. So I'd like to take this opportunity now to introduce Samantha Greaves, who is also my mother, to address the group and kind of let us know what to expect in the coming future, and also what we've done in the past year.
Okay, I've made notes, so I hope they're good notes. Good morning, everybody. Thank you for your attendance, and welcome to the first annual general meeting, as Ian said, for Sickle Cell Cause. As you know, my name is Samantha. I'm the group coordinator, and I've been the group coordinator for the last year, and I want to start with our awareness programs. Right, so over the last year, 2015, we had a more active year with regards to raising awareness than we actually anticipated. So in May, we spoke at the Shane Project Network Club in Edmonton, and that's an organisation for people with multiple sclerosis. So they're a charity that they work well for countrywide, and they're based in Edmonton, and we've done a talk there about sickle cell, and we work very closely with them. In June, we've done an awareness program for at the Romford Labour Party, Harold Hill Library, and then we've done a talk on Conscious Radio, More Knowledge Show in Hackney. And thanks to the DJ here, Carl, who's also our film, right? And in July, again, we was at Harold Hill Radio lunchtime show, and at Suffolk Baptist Church in Enfield. In September, we was at the Our Legacy quiz night in Walthamstow, and in November we was at the new annual Melanin Market at Back to Eden Cultural Shop in Hackney. So that's the awareness programs that we done last year. Next we have advocacy, and with regard to advocacy, in January we set the motion for our parliamentary campaign. I'm forgetting to change the slides. We set in motion for our parliamentary campaign, and we spoke with ex-Labour MP for Edmonton, Councillor Andy Love, who's very supportive when it comes to sickle cell, and he introduced us to who is now the new councillor, Kate Osamore, who preceded him as the MP, and we also spoke to Samuel Gold. He's an MP, Labour MP for Romford, and we had a brief conversation with Diane Abbott in Hackney. And that was all in January, and we're still working on our parliamentary campaign to get sickle cell recognised at parliamentary level. We've got a lot of work to do, we need a lot of support, but it's a battle that we intend to win. In November, we wrote to the National Hospital, and are now in discussion to formulate a plan of action with regard to accepting sickle cell awareness amongst their staff, and we hope they will accept this process, because our very own Dr. Yardeman, who expect to be here soon, has offered her support with this matter. Next we have signposting. We share information from our incoming queries from individuals as to who is the closest support groups to help them in the community. Alright, so we liaise and bond especially with other UK-based support groups to form lasting and positive relationships and friendships. And we are proud of the volume of international signpostings we have achieved as well. Most of these signpostings have been done by social media, especially Facebook, on our Facebook page. So if anybody's on Facebook, you should look us up on Facebook and join us on our page. And internationally, the countries that we liaise with, the majority of them are in Ghana, Nigeria, the USA, Kenya, and the Gambia. We give special mention to the groups Tame Sickle Cell in Ghana, Silly Cells based in Atlanta, Georgia, and in fact the coordinator, her name's Angela, she was going to be here today, but with sickle cell she got sick, so she wasn't able to make the journey, but we was expecting her to come, and she's upset that she couldn't be here today in England, but I'm hoping that she gets well soon. And also Sickle Cell Support Group from Africa. Right, so we plan to collaborate with them a lot further during this year. Social media is also mainly responsible for the volume of queries we have from the UK. The larger volume of our signposting so far has been to Enfield Sickle Cell Support Group, and St George's Support Group in Tooting has been second, and Luton being third, with 2 individuals being referred there during last year, during 2015. Okay, next we have counselling. Before the sad passing of Dr. Neville Clare, he gave telephone counselling to patients who would meet up with patients every Tuesday at the North Middlesex Hospital, where he continued to work with patients to assist with controversial housing conditions and medical treatments. Most of these patients were residents of Enfield and Haringey, although our list includes members, countrywide. Curtis Stewart and I were also hands-on with telephone support to our members, which strongly includes empathy. We like to emphasise that we include empathy because we found it lacking a lot of support groups where people have no empathy towards what the condition is. And also with home and hospital visits and letter writing. Myrtle Thomas has been kept very busy with one-to-one support and assistance with benefit forms, housing and GP support. So next I'll touch on services, which are, and mentioned earlier, to actively work hands-on with other support groups in the UK. So far we have signposted individuals to groups more accessible to their location and needs, and we also liaise, as I said, with UK and worldwide groups via social media. However, we feel we can be more effective with our aims and objectives if the groups in the UK were to work closer together on projects, supporting each other to obtain unified success. And when I say unified success, I mean like funding as well. Because if we go for funding, if more groups went in and was claiming for say the National Lottery funding, if we're serving more people, they're more likely to give us the funding, and then we can divide it up and make sure that everybody UK-wide gets something to help, rather than individual groups going for these fundings and not getting, and being refused it. Okay, so we'll be working closely on that. Right there, I've lost my space. Okay, yeah. Okay, we have made arrangements to meet up with the Sickle Cell Champions. They're based in Belvedere, and also the Haringey Sickle Cell Support Group, which is actually based here at the George Marsh Centre. And at this point, I'll give a mention of the names of the volunteers who have. No, actually, I won't do that yet. I'll leave that for you to. We're going to mention the names of the volunteers. Okay. Right. So next, we're going to talk about our welfare department. Right. So we have Myrtle Thomas, as I said, and she's an independent who assists with completing personal forms, for example, benefit forms, GP and housing forms. The late Dr. Neville Clare, who sadly passed in July, was our medical support advocate, and until his passing in July, he assisted our sickle cell patients countrywide with all aspects of social and personal challenges living with the condition. Next, we have our holistic services. We have Ms. Brenda Spooner, who's sitting over there. She's our qualified massage therapist who offers treatment that greatly reduces costs to our members, and we'll be speaking about her service a little later on. Then you have myself and Curtis, and we do the healthy cooking presentations. And then there's the Healthy Living organisation, who head up the Health Enhancement Project, which is in Spain, whereas we go to Spain and we have detox and reflexology, massage and complete cleansing, eating a raw diet. And I say raw, I mean vegetables and fruit, not, and you come back feeling completely refreshed, and it's also educational because it gives you a mindset to change your lifestyle or make changes to your diet. You find that there are things that you decide that you want to cut out and want to leave out of your diet. So at our next meeting we'll be talking more about the HEPS project, as we like to call it. And then we have business and financial services, and then that's Mr. Phil Akintunde, who's sitting here, and he's our lifestyle coach and home business building advisor, and he's been very inspiring and hands-on with support and advice with people doing home-based businesses. So he helps us to do things like that. So with people like myself that find it